Prescription costs are something that many Americans worry about. And right now, about 150 drug makers are increasing costs by more than 6.5%, impacting nearly 900 products. People who rely on life-saving medications on a daily basis are urging Congress to stop the increase. News 5's Meg Shaw shares their message.
I was diagnosed with type 1 diabetes back in November of 2000.
36-year-old Marcus LaCour from Cincinnati lives with a chronic disease, diabetes, and he relies on insulin to survive. He's about one of 37 million Americans who have diabetes. He says it was in 2006 when he noticed the price for his meds starting to go up.
And it went from being $30 a vial for each to $50 a piece for each vial. So you go from spending $60 to $100.
According to AARP, from 2006 to 2020, prices for 65 brand name drugs increased by about 276%. 276.
Even being in that position where you're trying to make 10 units of insulin stretch until you can find another vial, or trying to make whatever you have last until something shakes, is difficult.
A recent survey from the Urban Institute found that more than 13 million Americans skipped or delayed prescribed medicines in 2019 due to their costs. Something endocrinologist Dr. Lale Razavi has seen firsthand.
I would urge everybody to not change their insulin, don't miss the dosage, and there is always some options for help.
A new record high of more than 100,000 Americans died from diabetes last year, according to CDC data collected by Reuters. LaCour and Dr. Razavi are just some of the many patients and doctors across the U.S. urging Congress to overhaul diabetes care and prevention.
Let's put a face to some of the pain that some people may be experiencing. Let's have that conversation.
We recommend that more manufacturers take the responsibility to produce biosimilar insulin rather than just a few manufacturers that are doing it right now. This will help us with the pricing as well.
Yeah, at the end of the day, it's got to get better. And my hope is that I'm able to push that voice out there to hopefully help make things better.
Right now, a plan for Congress to cap insulin prices at $35 a month is still being negotiated as part of the Biden administration's Build Back Better legislation. For News 5, I'm Meg Shaw.